This presentation looks at the assessment for the module Adopting the Role of the Registered Nurse. It might feel a bit of a hard slog to have a 3,000 word essay as your last piece of coursework, but if you think about it, you've been working on your portfolio for nearly 3 years now, and you've been building up your theoretical and clinical nursing knowledge over that same time period. So this essay is a chance to put all of that together to see just how much you've learnt, and also to demonstrate that you're ready for registration. So the assessment itself asks you to choose an aspect of your clinical practice and then to reflect and critically analyse your professional development in that particular practice. And you do this by drawing on evidence from your portfolio. Probably the first piece of advice I would give is to make sure that you're taking quite an academic approach to this essay. Yes, it's about you and your professional development, and yes, you'll be using evidence from your portfolio to back up your points, but it is still an academic piece of work, so follow the usual conventions in terms of providing evidence for everything you say, using formal academic language. It's also really important that you think about the structure for this essay. It's 3,000 words, so it'd be very easy to lose the reader when you jump from topic to topic. So make sure that you've got a very strict plan and you know exactly what you're going to cover and the order that you're going to cover it in. And also make sure that you are writing at level 3, so that you are being critical and analytical. You're not just describing a particular event, you're actually discussing its meaning and how it relates to the wider policy and research. Think really carefully about what aspect of clinical practice you're going to discuss. So it's got to be something in which you can show professional development. It isn't about choosing a topic like nutrition in the elderly. It's more about choosing a skill. So perhaps your use of communication massively improved as you knew more and more, and you can then relate that to the theory and research and demonstrate it through your portfolio. It's also been suggested that you could perhaps use a reflective model in order to frame your discussion and demonstrate that you'd improved or developed professionally in that particular practice. You're given really clear guidelines within the module handbook, so make sure you keep reading those and go back to them several times. It's easy to get sidetracked or to write the essay you wished had been set rather than the one you've actually been given. And within it, they tell you what to do within the various parts of the assessment. So within the introduction, identify the area of practice that you're going to be discussing and also give a rationale for that choice, not only in terms of your personal development, but from an academic perspective. So why does this area matter for nursing in general? And then set the scene for the reader. So just provide some background information so they know about the general topic. The main body is where you'll do the reflection and the critical analysis of your professional development. And what you need to do is look at the aspect of clinical practice and then compare and contrast it to nursing theory. What does best practice say? And is that what was happening in your own case? What evidence is there to underpin that best practice? Is it supported in research? And then bring in aspects of your portfolio that demonstrate your professional development. And it's important you don't just say, see Appendix A to C. Actually explain what the portfolio is demonstrating. And then finally make recommendations for your own continuing development. You don't have to say, I am absolutely perfect at this. It can be, well, there's still gaps and here's what needs to be done about it, in true reflective style. And then in your conclusion, you basically summarise the main points and make sure that you're not including any new information. If it's important enough to go in the conclusion, it should have been covered in the main body. You've finally got your references, and make sure you're using the most up-to-date reference guide, which will be available on GCU Learn, and then your appendices, which are the pieces of your portfolio you're using as evidence. The marking matrix is given to you in your module handbook, and again it's worth paying pretty close attention to. It's what the markers will use when they're assessing your work, so give them exactly what they're after. Make sure that you're able to proofread your work and that you could say, yeah, I'm in the good or the excellent section. That you have, for example, provided a good balance between depth and breadth, or that you've demonstrated critical thinking. Also make sure you're aware of how much of your marking is going to application to practice. So constantly be thinking about, what does this mean for nursing? What does this mean for my nursing? We're around over summer if you do require any support, so come and see us within the Learning Development Centre. We obviously wouldn't proofread your work, but we'd certainly look at creating a plan with you or talking through any aspects of the essay. So please get in touch with us, or you can get in touch with myself as the key contact for nursing students.